My research is part of the multimorbidity theme of the Oxford CLAHRC, and it focuses on the problem of depression in people with cancer. So multimorbidity just means that someone has more than one medical illness, and our theme in the Oxford CLAHRC is particularly focusing on people who have what we call medical-psychiatric multimorbidity. So that means people who have what we traditionally call a medical problem, and also what we might traditionally call a psychiatric or a psychological problem. We know that depression is a really common problem for people with cancer. About 10% of people who have a diagnosis of cancer will also have what we might call major depression or clinical depression, but the majority of those people don't get treatment for the depression. So our team has developed a new treatment programme called Depression Care for People with Cancer, and that includes treatment from a team of cancer nurses and psychiatrists, and they work together to make sure that the patient's depression care is part of their cancer care, so it's fully integrated. And that's really important because having multiple medical problems has a huge effect on people's quality of life and has an effect on the healthcare that they need. Usually research is done to focus on single illnesses, but as we have an ageing population and more people have lots of medical illnesses, we need to do research to work out what the best care is for them. The research that we're doing with the Oxford CLAHRC is all about integrating mental and physical health care and making sure that we can improve people's quality of life when they have multimorbidity. So we have two new research projects that are part of the Oxford CLAHRC. The first project is adapting that treatment programme for people who are coming towards the end of their lives, so people who need palliative care, and we're doing that in collaboration with Sobel House Hospice. The second project is working out how exactly we implement this new treatment programme in cancer centres. So we know it works very well, but we don't know exactly how to implement it in the real world. And we're doing that in collaboration with the Oxford Cancer Centre and with our colleagues in the Wessex CLAHRC, as well as with some support from Macmillan Cancer Support. I've worked with people with cancer for a very long time, for more than 10 years now. I've also worked clinically in hospices and cancer centres for quite a long time. So I see people every day in my clinical work who have depression, who have anxiety, and their treatment really isn't very integrated. So they get very separate care for their cancer and separate care for their mental problems. And so it's been a big interest of mine for a long time about how we can best make sure that these people have a better quality of life, but also make sure that their care is fully integrated. Because as we all know in the real world, people are just people. You don't have a separate brain and a separate body, but we have separate hospitals for these things. So all our projects in the multimorbidity theme aim to improve the care that patients get when they have complex medical problems, and that's particularly important when people have a medical problem and a psychiatric or psychological problem, and integrating their care and researching how we best do that in an effective and safe and high quality way is what we're all about.